الرحمن الرحيم. بسم الله نبدأ المؤتمر الأول للابتكار في مجال طب الأسنان. بتقيمه كلية طب الأسنان جامعة 6 أكتوبر بالتعاون مع نقابة أطباء أسنان القاهرة. وبيشرفنا إن احنا نحط محاضرين على مستوى ممتاز عشان ينقلوا لكل الحاضرين إن شاء الله أفضل ما في طب الأسنان. إن شاء الله بإذن الله تعالى على مدار اليومين هتستمتعوا جميعا معنا بمحتوى علمي أعتقد إن شاء الله لم يشهده مؤتمر من قبل، لأن كانت اللجنة العلمية بمنتهى الدقة وبمنتهى الحرفية إنهم بيختاروا أفضل من لدينا سواء في مصر أو في الدول العربية لإلقاء محاضرات. وفي نفس الوقت إن شاء الله في الدور الخامس عندنا الورك شوبس. الحمد لله أنا لسه دلوقتي حالا فاتح الويب سايت. الورك شوبس حصل عليها إقبال. إحنا كنا حاطين التارجت بتاعنا 20 لكل ورك شوب، فوجئت ان في ورك شوبس بقوا 36 و37. الحمد لله. بشكركم على ثقتكم في بورد المؤتمر، ونبدا الجلسه الاولى. واسمحوا لي اقدم انا للتشير بيرسونز بتاعت الجلسه الاولى. يسعدني ان يكون معانا الاستاذ الدكتور الألفت السيد حسنين، احد قامات العلاج التحفظي في مصر ورئيس قسم العلاج التحفظي جامعة القاهرة السابق، وحاليا بتتبوأ مناصب كتير قوي. هناخد ربع ساعة ونضيع وقت الدكتور عمر في ان احنا نقول البايو بتاع الدكتورة ألفت. اما على المنصة اقول اختي الكبيرة وزميلتي العزيزة، وهي احد علامات قسم العلاج التحفظي بكلية طب الأسنان جامعة القاهرة، الأستاذة الدكتورة أميرة فريد الزغبي. وفي الحقيقة الدكتورة أميرة من الناس اللي معرفهاش خسر كتير. أهلا وسهلا بيكم في مؤتمرنا، وهسيبكم بقى تقدموا كريمة المؤتمر.
Good morning. The first lecturer in this session is Professor Omar Zidan, Professor of Restorative Science, University of Minnesota. The lecture title will be Which Cement to Select, How to use it optimally to achieve long-term أنا أشوفها من هنا أحسن. Long-term clinical success of crowns and implants. Let's welcome all Dr. Omar Zidan.
بسم الله الرحمن الرحيم. It is a tremendous pleasure. سعادة غامرة بالنسبة لي إن أحاضر لهذه المجموعة اللي هي مجموعة من الأحبة من الوطن الأم اللي هو مصر. أنا سبت مصر من زمان قوي. سبت مصر 27 سنة، بقى لي 42 سنة في بره يعني. And I have been doing dentistry for a long time, very long time. Okay, يعني أنا عديت نص قرن dentistry. I am الحمد لله رب العالمين. I am still practice fully. I practice dentistry. I teach. I lectures. عادة محاضراتي من 2.5 ل 3 ساعات، إنما هنا يعني قالوا لي لا يعني ادينا بس نبذة. So I'm going.
ممكن بس المايك يبقى قريب شوية.
قريب كده؟
أيوة.
نبذة سريعة عن one of the aspects which I think we call it في أمريكا بنسميها the bread and butter of dentistry. هنا طبعا ما اعرفش يسموها العيش وملح whatever, but this is fundamental. How to produce a successful crown for a long period of time. طبعا لما الواحد هيعمل كراون وقاعد في نفس المنطقة، الكراون لازم يعيش forever، يعني مش forever على الأقل يعني 15 ل 20 سنة. So what I'm talking about is some element now of making those crowns very successful to survive for a very long time. أقصد بذلك إن الكراون ده is 3 components. You have the tooth, you cut the tooth off, right? Prepare it. وبعدين a crown is fabricated, metal or ceramic, and then it is placed over the tooth. أهم حاجة في الكراون اللي هو الانترفيس اللي هو ما بين restoration and the tooth. This is very important. This is the heart of the success of the crown. Visually, we cannot see this. Visually, we assess the crown through its margins. Okay, so we look to the margin either visually. Sometimes we feel it with Explorer if there is an overhang, is an open margin, and so on. But we cannot assess what is happening at the interface between the crown and the restoration. And this is what I'm talking to you about today. The crown is the space, our interface is filled with what we call a looting agent. A looting agent. اللوتنج ايجنت هنا بالنسبه لي في 3 عوامل، في parameters، متغيرات، 3 متغيرات. I call them hyper parameters. لما بيجوا يعملوا زي an AI program for large language model, there is lots of parameters, right? Now we are talking billions of parameters. ال3 parameter دول for me is under a category we call it hyper parameters. يعني ال AI ما يقدرش يتلاعب بيها. ال AI بنقول ال AI no, these are parameters which is not for you. Okay, this is have been decided a priori. اللي هم البonding as far as I'm concerned, a looting agent has to bond to the crown material and has to bond to the two structure. مفيش تفاهم في الموضوع ده. البارامتر الثاني ان ال looting agent has to be strong. So if I have a looting agent which is strong and the looting agent which is stronger, I will go for the stronger looting agent. البارامتر الثالث الstability. I cannot deal with a looting agent which is less stable. Okay, so if we are comparing between different type of looting agent, I will go for the most stable, the least solubility. فدول كبداية دي كل الفكر اللي أنا هتكلم فيه مبني على الهايبر بارامتر دول، البوندينج، السترينث والستابيليتي بتاع اللوتنج ايجنت. Now we move on and المحاضرة القصيرة جدا دي هتبقى بتتكلم على five variables, 5 parameters. I'm going to talk about the two structure. هل البريباريشن بتاعتي is it retentive or non-retentive؟ ده هيحدد which type of looting agent I'm going to be using. هتكلم على التيشو because we are talking about bonding, so bonding to enamel and bonding to dentin. هتكلم على اللوتنج ايجنت نفسه، 3 category of looting agent اللي عندنا اللي هو resin modified glass primer and 2 of the adhesive cement. One is self-adhesive cement and the other one is adhesive cement used with bonding. وبعد كده هنتكلم، طبعا ما تهيأليش هلحق اتكلم في كل الكلام ده، but I will try to do my best. هتكلم as much as possible وهشوفكم بقى السنة الجاية ولا حاجة. Okay? الinteraction between the looting agent and the restorative material, mainly the metal and the ceramic, على 3 عوامل هنتكلم. Can we bond? How good we bond? Okay, and the interaction in terms of aesthetic and strength. So let's go on and start with the preparation. Preparation, we need to decide if the preparation is retentive or non-retentive. أول حاجة هنا you look at this preparation شكلها مش بطال يعني. يعني I think this is a reasonable prep. Okay. بالنسبة للtaper of the prep, let's measure that. Okay, these are the long axis of my prep. And then this is the measurements. And we find that the taper of this crown is 20 degrees. بالنسبة للبارامتر of a retentive prep احنا بنتكلم على أساس إن التيبر بتاعي بيتراوح ما بين 6 degree to 12 degree. يعني 3 و3 6 و6 and whatever in between in order for the preparation to be retentive. يعني beyond the 12 degree بنعتبر the preparation is not retentive. For me this parameter is not, even it is written in all the textbook. As far as I'm concerned أنا ما اهتمش بالموضوع ده anymore. Okay? As long as I'm going to bond زي ما هقول لكم. فده ال preparation هنا it is 20 degree, it doesn't bother me very much. But in order to be retentive, if you are to use the classic parameters, you have to be careful about that. We are going to talk about this. البارامتر الثاني اللي هو ارتفاع البريباريشن نفسه، ارتفاع الوال of the preparation من المارجن لحد الاوكلوزر. It is 4 millimeter or more. Less this, the preparation is non-retentive. The preparation like this one, okay, the measurement here is أقل من التولرنس، أقل من اللي هو المقبول اللي هو 4 millimeter. This is 3 millimeter. In order to modify this particular prep from non-retentive to retentive, محتاج أنزل بالpreparation بتاعتي quite deep here. I'm going to be below the gum margin. ودي حاجة بالنسبة لي is a no-no. I will never go below the gum. Okay, I have other approaches for that. Even it is not retentive, it is fine for me. I'm going to tell you about solution for that. وتالت حاجة ال surface area. The larger the surface area, the better, the more the retention you are going to have. فإذا كنت شغال على molar, المولر there is a lot of surface area, it's going to give me a lot of retention. مثلا شغال على lower central incisor is not as much. Okay? There is ways to increase the surface area. One of the way I deal with, okay, يمكن برضو من الحاجات حتى الجماعة الأمريكان في الحاجات اللي زي دي يعني زي ما تقول يحصل لهم ضغط شوية. I will not leave on my build-up material. I will not leave on my prep any type of restorative material. Everything is going to go out. By doing this, I'm increasing my surface area, so I'm getting a better bond. يعني for me, build-up مش جزء من القاموس بتاعي anymore. It's gone. This is an example for this. This is الشخص ده it's me. Okay, this, no, not this one, another one. ده مش أنا. So another preparation like this. أنا آسف الصور طبعا هنا أنا الصور بتاعتي جميلة جدا يعني. إنما البروجيكتور ما هواش جميل جدا. I'm very sorry. ده الريزوليوشن بتاع البروجيكتور not so good. Anytime I have a root canal, I'm going to do some people call it an endocrown. I'm going to prepare inside the root canal. I'll just go in and prepare, and I will get this walls, which will give me a lot of retention. This is called endocrowns. And this, of course, is done by اللي هو CAD/CAM technology. This is my own tooth here. يعني اللي بعمله بطبقه ببقي is doing very well. I had a crack. في crack هنا أنا آسف إنه مش باين on the distal surface. I have been babying sitting this crack for 4 years. And then one night كنت في مصر قاعد مع دكتور محسن. كانوا they have a very nice meal of fish. مش قادر آكل. Because the crack have changed to acute pulpitis. So a root canal was done and it is covered. And as you can see here also in the preparation, the preparation have been prepared with using the pulp chamber to improve the retention of the crown and improve the resistance. اللي عمل لي preparation دي رئيس القسم بتاعت البروس. And then I took my own impressions بالCAD/CAM, and then she was very uncomfortable. And then I told her exactly what to do in terms of the prep. You are going to cut the margin half the buccal, half the lingual. طبعا you have to clear the two proximal. وللاسف انكم مش شايفين هنا. بعدين بعد ما صورت في الاخر I was doing my own pictures for the crown. I find that she have put 2 dimples there. She told me, Omar, this is for retention. Again, she's not very believing in this. طبعا هي غلطانة 100%. But she's very good. This is why I let her cut my teeth. نيجي بعد كده اللي قلناه ده. اتكلمنا على 3 حاجات. اتكلمت على التيبر 6 to 12. اتكلمت على الهايت minimum 4 ملم. واتكلمت على السيرفيس اريا. If element اللي بنتكلم عليهم, if the taper is more than 12, so the preparation is not retentive. If the height is less than 4 millimeter, the preparation is not retentive. If the tooth is too small, the preparation is not retentive. Okay? فلما بنيجي نعمل القرار هنا, what I'm going to be using, if the preparation is not retentive, it is not an option to cement. ما ينفعش. In order to cement, if you are going to cement, the preparation has to be retentive. فيها العوامل اللي أنا اتكلمت عنها دي. If the preparation is not retentive, your only option is to go for bonding. So let us talk about bonding a little bit. Bonding enamel and dentin. Bonding enamel have been very simple, very reliable. It was introduced in 1955 من واحد اسمه Bunocore. Bunocore discovered that if you apply some acid over the enamel, طبعا الانامل is very dry, ما فيهوش ميه كتير, ما فيهوش organic material كتير, نفس الستراكشر بتاعه في enamel rods. هنا الاسيد بيعمل selective decalcification. والenamel once you have applied the acid, it look like this. As you can see here, chalky white appearance, and you create this huge microporosity. معظم البوندنج, all our bonding, 90% or more in dentistry, أي نوع من أنواع البوندنج في الدنتستري is depending on the microporosity, on the micromechanical retention. في الانامل نتيجة إنه dry, it's very easy to get this micromechanical retention. فسهل جدا إن إحنا to bond to the enamel. And this is a picture of what I'm talking about. You see the composite, you see the enamel. The enamel have been etched, the resin tag have penetrated through the enamel, and you get a very solid bond. الصورة دي قبل ما معظمكم يتولد, I was doing my PhD in Denmark, and this is how it looked like. في طريقة تانية لetching the enamel is self-etching. بدل ما بنستخدم acid ونغسل الacid and we dry, no, we are using something called an acidic phosphorus monomer. So the phosphorus monomer بياكل شوية الانامل and create some type of microporosity. This is not indicated because you are violating your bond. The ideal bond to the enamel is acid etch, hydrophosphoric acid. You etch 10 to 15 seconds, wash 10 to 15 seconds, and dry 10 to 15 seconds, you got your bond. So I do not advocate self-etching for the enamel. The etching to the enamel has to be a total etch. Apply the acid, wash it away generously, 15 seconds, 10 to 15 seconds, and then dry it 10 to 15 seconds. المشكلة بقى في الدنتن. الدنتن to bond to the dentin, it took us many years to bond to the dentin. نتيجة إن الدنتن is very wet, full of organic material. We did not get the idea how to bond to the dentin for a very long time. أنا كنت سعيد الحظ إن during my doctorate degree I worked with مجموعة من العلماء very good. واحد اسمه يارجنسون, واحد اسمه اسمسون, واحد اسمه فينر اللي هو أول من أدخل real bonding to the dentin through a material he called gluma. The challenge هنا, this is what they did. Acid etch, prime, and apply your adhesive. This is صورة من برضو رسالة دكتوراه من زميل مصري كنت المشرف عليه, جالي في مينيسوتا. And this is once you bond to the dentin, we dissolve everything away. So in order try to visualize this, the composite we have a layer of adhesive, وبعدين we have here a hybrid layer. المسافات هنا very small. 1.5 micron, 1.5 micron, these are 3 microns. Okay? Now I think we can bond successfully also to the dentin if it is done right. الصورة اللي وريتها هنا the first generation of the successful bonding agent, we call it generation 4. 3 خطوات: etch, prime, and adhesive. الشركات for some reason وابتدتهم 3M قرروا قال لك 3 بوتل ده كتير قوي. احنا هنعمل ايه؟ هنحط البرايمر مع الادهيزيف وجم بجنريشن 5. جنريشن 5 عامله مشاكل كتيره جدا. وفرح told me this, that when she do her clinical cases and some of her classmates when they do their clinical cases, their main challenges is after they put the composite in the mouth of the patient is having sensitivity. ضرسه أو سنته بتوجعه. Why? Because of this. Okay? ده البرايمر والادهيزيف موجودين مع بعض. البرايمر اسمه هيدروكسي اثر مسكريليت اور هيما dissolved in water مع الادهيزيف اللي هو المونيمر سواء بس جي ام اي او يوريثين دايميثاكريليت dissolved in alcohol. طبعا ده حديث يطول يعني I'm sorry ان انا يعني بكروتكم but I am working with time now. Okay, I'm almost halfway. Generation 5 is very challenging to use. I use generation 5 all the time. In order to use it properly, you are going to etch 10 to 15 seconds, wash 10 to 15 seconds, dry 10 to 15 seconds, and then you get enough of this material. Let's do عندكم شوية كرم. You got enough material. You put it on the surface. You agitate it. You get some fresh, agitated. Don't rub the surface because the surface at this point of time is very fragile. You do this for 10 to 15 seconds and then you dry very gently until the material stops moving. The solvent will evaporate and you'll see just a shiny area and then everything is not moving and then you hit it with the light. And this will solve your problem in post-operative sensitivity. This is صورة من الرسالة الدكتوراه بتاع الدكتورة منى غنيم. She's going to give a lecture here. She's very good in aesthetics, so try to يعني المحاضرة بتاعتها will be very exciting. أنا المحاضرة بتاعتي dull شوية, dry شوية, very scientific, but محاضرتها جميلة عادة. This is the dentin have been etched aggressively to show the challenge. This is collagen fiber, full of water, and you need the bonding agent to penetrate this. So this is the challenge of generation 5. You have to do this very carefully. Generation 6 is بنسميها, actually this is generation 7. بنسميه self-etch bonding agent. A self-etch bonding agent, ما فيش acid, ما فيش washing. Okay, so now we have in the bottle something called primer. البرايمر هنا ده عبارة عن acidic monomer. ده في generation 7 the only material which succeeded is the material clear fill from clear fill self-etch from Curari. Curari ده جزء من شركة اسمها نوريتيكا. دي شركة ياباني. نوريتيكا دي شركة كبيرة جدا بس يعني بتعمل ايه؟ بتعمل طباق, بتعمل الحاجات بتاعت المطبخ, كلها سيراميك, وعندهم فرع صغار خالص, حاجات صغيره خالص بيعملوا حاجات طب اسنان. And their material is very good. By the way, I do not support any company. Okay? يعني دكتور محسن قال لي ان الكومباني دافع على الاوتيل, قلت ما جيتش. هو مش عارف ليه انا ما جيتش. Because the company is paying the hotel. فاضطريت اسوق وجيت واتخانقت مع الناس تحت ما كانوش عايزين يدخلوني. Anyway. So the only one which worked is this one. The clear fill SE bond. ليه؟ لأن اخترعوا حاجة اسمها 10 MDP. المونيمر ده مونيمر سحري هايل. And they controlled the market for about 18 years. Once اللي هو البيتنت أو حق الاختراع انتهى, كل الشركات started to use the 10 MDP وجم ب generation 8 of bonding agent which is called the universal bonding agent. كل دول بيحتووا على ال 10 MDP. Why so successful? You can read about it. I will not be able to cover this right now. Okay, so now we have two possibilities for getting good bond to dentin, either with self-etch through the universal أي حاجة فيها 10 MDP or total etch also with the acid. الانامل احتمالنا الوحيد هو total etch. We never do self-etch for the enamel. If we combine both بنسميها selective etch. And selective etch ده مش not for me by the way. يا total يا self. يعني إذا كان dentin بس I will go self-etch. إذا كان enamel and dentin I will go total etch. إنما أقعد أعمل painting للانامل it's not لا مش ليا لا. Now let's talk about loading agent very quickly. Loading agent في عندنا نوعين أساسيين. في السمنت اللي هم هنستخدمهم لو عايزين في الريتنتيف بريباريشن. السمنت ده عبارة عن resin modified glass ionomer. وبعدين أو هنعمل bonding في عندنا two type of cement. We have the self-adhesive resin cement and the adhesive resin cement. بالنسبة للcementation with the resin modified glass ionomer ده material للأسف is very popular. في أمريكا is very popular. معظم دكاترة السنان they move to this. Why? Because it's very easy to use. Okay, the excess removal is very straightforward. Okay, يعني you put the cement in the crown كل العيان يقعد تروح تشرب كوباية شاي وترجع تاني تك 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 everything is removed. Why? Because the cement is not strong and there is no bond almost. Okay, so this is the resin modified glass ionomer is popular because ease of use. The self-adhesive resin cement and the adhesive resin cement دول هيدوني البرفورمانس اللي اتكلمت عليه في الاول اللي هو الهايبر بارامترز. It's going to give me bond, it's going to give me strength, it's going to be less solubility, but it is challenging to use. 6 دقايق ماشي. A self-adhesive resin cement, yes, it will give the bonding, the strength and stability, but at few step lower than what we call the طبعا في كتير جدا من السيلف ادهيزيف ريزن سيمنت ابتدت جنريشن جديده تطلع بيسموها سيلف ادهيزيف ريزن سيمنت يونيفرسال وبعد كده دلوقتي ابتدينا نعرف ويقولوا لنا it's better any time you are going to use the self adhesive resin cement to use bonding معاهم. يبقى هم مشونا دلوقتي الى الستيب الاخرانيه هنا اللي هي ال adhesive resin cement. adhesive resin cement بنفكر لما باستخدامه كأن الواحد بيعمل composite exactly like you are doing your composite. Okay, so you are going to do the etching, you wash, and then you apply the material and it will bond to enamel and dent. مجموعة كبيرة من الماتيريال, all of them are, their performance is the best. This is one of the best material to use. The adhesive resin cement is the most challenging. You have to use it properly. You have to get used to it. You have to move very fast removing the excess in order لو الماتيريال دي مثلا حصل لها setting قبل ما تشيل الاكسس من البروكسيمال والكلام ده كله it's a nightmare. You should not do that. So you have to be use it yes but know how to use it. ماشي. آخر حاجة هنا الinteraction between the loading agent and the adhesive resin cement. البارامتر البonding, الstrength, الaesthetics. Can you bond to gold? Yes, I can bond to gold. How I get the micromechanical retention? With air abrasion. Air abrasion بعد كده في sulfur compound as a primary bond بتاع 5% 10%, and then you can use your dual curing أي حاجة بقى. يعني يا إما resin modified glass ionomer, self adhesive resin cement or adhesive resin cement. الstrength ما تفرقش. الجولد is strong. So you don't need any type of cement to improve the strength of the gold. You don't have any type of مثلا aesthetic demand when it comes to gold. فما تفرقش what you are going to be using. If the preparation is retentive and you want to use resin modified glass ionomer, it's okay. PFM نفس الكلام. مثلا ده هيبقى السيراميك. This is the high glass low strength ceramic we use for veneers. In cases like this, you don't have any option but using the adhesive resin cement. So actually, specific type of adhesive resin cement which will give you a lot of shades in order to finalize the color of your veneer. You etch with hydrofluoric acid, apply your silane, you etch the tooth with phosphoric acid, and then this is the different types of resin cement to get your bond. Very successful. I mean, this is very successful restoration. تشهد عليه درس من دروس زوجتي اللي قاعدة هنا دي. I have done this for many years now. She didn't want to do it. She told me, get your hand off my amalgams, until she got the crack and she got the endo, and I restored it for her. زميلتي by the way in the same class, بس هي مش شاطرة زي. هي بتعمل كنافة هايلة بس أسنان لا. I mean كنافة هايلة. Okay. بالقشطة.
Professor Omar.
أيوة.
2 minutes left, please.
2 minutes. طب ما نتكلم في أي حاجة بقى تاني ها؟ 2 minutes خلاص ها؟ Come on. Anyway, that's fine. ده مثلا 2 minutes. بالنسبة للسيراميك اللي هو هاي جلاس هاي سترينث زي الاي بي اس امبريس اللي هو الليثيوم دايسيليكيت. تاني hydrofluoric acid silane, and then you bond it with adhesive resin cement. دي بياعة كنت بشتغل معاها في محل عندنا مهم اسمه ميسز. استنت لما ورثت and she was not young and she wanted السمايل. أمنية حياتها to get the smile, and she got the smile. I helped her with that. ست رائعة جدا. كلمتين هنا، كلمة واحدة بالنسبة للزركونيا. زركونيا نفس العوامل بتاعة الجولد. So you are going to do air abrasion. You are going to put the 10 MDP, and then you are going to use one of the resin cement. If your preparation is retentive and you want to use self-adhesive resin cement, a lot of people will do this. آخر حاجة هنا السكيل بمعنى إيه؟ بمعنى understanding of the material aspect of the material you're using is very important to assure the clinical success. أنا آسف إن أنا كروتكم, but I did my best. Thank you very much.
Any questions? Thank you, Dr. Omar, for your valuable lecture. It's an honor to
اسمحوا لي, we are so lucky to have Dr. Omar Zidan with us today. دكتور عمر ان شاء الله باذن الله التايم از فيري شورت, عشان دكتور عمر لما سمعتوش انتوا محاضرات, احنا اتربينا على محاضرات دكتور عمر. ان شاء الله باذن الله انا بعد اذنكم هعمل له سبيشال انفيتيشن عشان يجي اكتوبر 6 يونيفرسيتي ويدي محاضره للبوست جراد والانترنشيب ذا جونيور دنتست ان اور سكول, عشان نقدر نستمتع اكتر واكتر بعلمه وبخبرته اللي فعلا one of the most precious items we have in our life. Thank you, Dr. Omar.